well as being I haven't anaesthetised for 3 years. I don't know whether I ever will again, who knows. I'm still working as a pain doctor at UCLH, but I'm also the medical director for South London's Academic Health Science Network, aka AHSNs. So I'm going to tell you a little bit about what they do. So one of the things we do is make really good communications, and this was made, I was coerced into doing this last year, so I thought I might as well save some breath, and you can watch this for a minute. Quite motivational watching some of these videos sometimes, but you go, yeah, I'm going to go to work today and speed up the best in health and care. So the Academic Health Science Networks, we're actually a network of networks. So you'll see there that so the Health Innovation Network is South London, so there's 2 ICSs, Integrated Care Systems for South London. So, but I'm also, I guess, I was aware of UCLP. Have you heard of UCLP? Wave your hand if you've heard of UCLP. I can see a few people, so I can see a hand there. So Ucl Partners is North London's Academic Health Science Network, but also extends up into Hertfordshire and Essex, up towards Cambridge. And the idea is that all of England's able to spread innovation via these networks. And I chair sort of the medical directors for each academic health science network across the country. So, but although we're across the country, the aim is that we work locally. So we bridge the sort of gaps between the NHS, social care, very important, we're health and care, academia, so all the universities, third sector being voluntary and charitable organisations, and industry, very importantly. So our 3 aims are to improve care, drive down costs, and to speed up economic growth, which is sort of the triad of how we can improve health and care for our nation. So so we work in our integrated care systems a lot, trying to understand what their need is and building capacity via various different things. And we work in a range of different innovative spaces, sort of in patient safety, public engagement. We do a lot of evaluation of what changes are happening, and sort of informatics, analytical support as well as sort of spreading, it might be a clinician or an industry-led innovation from other areas. That's the whole point about if something works in Yorkshire, then we'll sort of think, well, it's been evaluated, been quite helpful there, would it work in London? So, and that's how these come about. These are the national programmes which we've run for the last 2 years. You'll see the Emergency Laparotomy Collaborative is down there. Now, of course, Neela was doing some stuff anyway, so you could argue, well, that would have happened anyway. But by bringing the acute trust together, there are 7 in South London, people were able to learn from each other quite well. And I know that Sam did that in North London, much bigger task because of the trusts going out into Essex and Hertfordshire, so much bigger geography, which makes it difficult. But you can see some of the things here, they're quite far-ranging. They're around mental health. Escape Pain, for example, is something which was started in South London as a rehabilitation programme for those with OA knees. And, it's found to be helpful, reduce costs, and, it does no harm. So these are the sort of range of different national programmes. And if you just look at one of them, AF here, you can just see how the AF programme was, very simple: detect, protect, and then perfect. So find people who've got undiagnosed AF, then actually do something appropriate about it, and then make it even better. So we do best when it's around pathway transformation. So it's not just about giving someone this little ECG device, which people used in GP surgeries, mental health settings, barbers, you name it. People went to all different places to see how these could be quite useful to pick up, and sort of faith and community centres as well, to pick up undiagnosed AF. And, you know, that combined with other sort of levers, like it being on the GP's QOF target, mean that we're actually, you know, you couldn't say this was there's not a causal relation there, but we're actually reducing AF related strokes, and we can show a more causal relationship in the boroughs where we've had more impact that we know in South London, for example. So the other thing I mentioned, the kind of driving economic growth. So our commissioners are NHS England and NHS Improvement, which is sort of the stuff you might expect, but also we get commissioned by the Office of Life Sciences, so a different part of government, and that's really to help all of the health and tech, digital, clinical, you know, all the innovators who want to spread their thing within the NHS. If you can imagine, imagine how hard it is even for a pharmaceutical rep to come and talk to you about a drug which is actually quite well known and evidence-based and available. If you're a kind of, you know, a lot of the tech companies are small, and lots of them have innovators that are clinical as well, and they just can't get in to talk to people and find out how they can make their things better. So we're enablers for that, and also we're brokers, so we sift out all the crap essentially, and give people honest feedback about things. And we then identify things that we think have got national reach, and then the Accelerated Access Collaborative might take those and say, this will be something that we try and enable nationally. And there's all sorts of difficulties around commercial law and procurement, so we've got to have very strict processes for that, and we're learning all the time about how to make those easier. The Academic Health Science Networks have only been around for the last 6 years. And so these are some of the things which were on the, so the Accelerated Access Collaborative decided that these things should then be made more available nationally. So you might recognise some of these things, but they're sort of, and I've put this up because anaesthetists are very familiar with bits of kit, and also that why is it that you get some things and not others. But we try to remove financial barriers. So these things were free for the period of the licence for trusts to adopt. So endocuff is just this really simple thing that goes up at the end of an endoscope, so that when people are doing colonoscopy, it means that they're more likely to see all the cancerous lesions. Secure cath is something that you might have actually seen in UCLH to secure your central line. Heart flow to make it so that you don't actually have to do an angioplasty, an angiogram on certain people, and Urolift, a day case benign prostatic hypertrophy operation. So, by the way, I know it's difficult when I'm sharing screens, but if you have questions, then please just jump in. I'll pause. There are any questions there? No? Okay, I'll carry on. So yeah, this is just to show how much we improve economic growth. This was in 1 year, so increasing, 700 jobs, supporting almost 3,000 companies. I can't see because of my thing here. But yeah, so we also, like once we get investment from other places and other people jump on board. So, I'm getting £150 million worth of investment. It's clearly a big number. So what does this look like in South London? So, this isn't even all of the people. This is like the hospitals, the acute hospitals, the mental health trusts, the universities, the local authorities and CCGs and ICSs. And then in that, you've got lots of innovators and companies and voluntary and community sectors as well. So we try and connect those people across South London. Obviously we don't, and a huge other field is care homes, which were very useful in the pandemic. So I'll come to that in a minute. Yeah, this is just a snapshot to show what we can do in a local area. That national programme in AF in 1 year meant that we did over 15,000 pulse rhythm checks. And when you multiply that up, so we will have avoided harm and costs. Same for all of the innovators. And for example, giving magnesium sulfate, we saw the uptake, you will be aware of that from obstetrics, but the uptake of that increased massively during our time, which means that, you can extrapolate to say that we saved 4 cases of cerebral palsy and the costs associated with that. Yeah, this is not all innovation is, high tech. very simple. This was a bag that was started in Sutton, the South London Borough, so that, guess what, when you transfer a patient from a care home to hospital, they've got all the stuff they need, including all the information, which makes it easier and better for everybody. So they're likely to go home quicker and better and more healthy. So, and then we spread that across South London. And then other things like education. So this is, it may sound really simple, but technically it was so difficult to do. So we have diabetes education programs, and you can do those. You can live anywhere in South London and go to any education course anywhere in South London. And you can also do that digitally as well. So when you consider that took work of working up 420 GP practices and 18 different care providers, you can start to understand how difficult that might have been. So, and now of course we've got that platform, would like to do it for other patient-facing education. Again, sort of thinking just differently, again, not necessarily high tech, but doing, you know, joint pain advice. It doesn't have to be a physiotherapist that gives advice about joint pain. It doesn't have to be a healthcare professional, it can be a receptionist. We've had great success with this model of care, which is people just being trained how to give advice to help people with their joints, which is usually simple things like keeping moving. And the Department of Work and Pensions has given us a grant because that's clearly useful for keeping people at work. So we'll move on now to Digital Health London, which is a collaboration across London. So this is something where the Health Innovation Network combines with UCL Partners and Imperial and MedCity, which is a much more an industry organisation. And we get funded by the EU, and still are being funded by the EU, even to next year, to fund this. And I just think I've got another video which will explain a little bit more about it. So we're just about to interview for our 5th cohort. So I'm interviewing companies next week, and it's always really interesting. And honestly, the work that these innovators put in is incredible. I'm always really impressed by them. So, and this is a very busy slide, but just to kind of show you sort of some of the impact from the first 3 cohorts. You know, love them or hate them. You know, Babylon was in the first cohort. Things like Medipad, so some really big names started on Digital Health London's accelerator program, and you know there's innovations in all of the trusts that you will know in North London and beyond. Yeah, with saving money for the NHS as well as improving care. So I can tell you more about that, but obviously I could go on forever. And in terms of digital, this is how we like to think of it. So what you've just seen is sort of supporting the NHS to find digital solutions, and we often hold events which are more than one solution, if you like, around, let's say we want to do cardiac rehab, what are the self-management and other digital apps and platforms that can help with that. So between NHS and care and digital providers, so it's like a sort of world cafe where people can meet, and we do that virtually now as well. so that people don't just have, you know, as it were, one person said, you know, people often come to us saying, we've had all these approaches by companies and we don't know which is which and how good they are. So we're building the capacity of the innovators by being on that programme. They really learn about the NHS and care, and also how to get evidence for their innovation and how to approach people like ourselves. But the other thing we do is build the capacity of health and care staff in a digital landscape. And I just thought I'd share some things about this. Last year we hosted 3 massive networks for NHS England and NHS Digital to support the global digital exemplars and fast followers. That was, so we had hundreds of people coming together to understand more about the medicines optimisation, mental health and learning and midwifery sort of work stream in that. Every year we have digital pioneers, so people who, you know, like any other sort of leadership programme will join us. There'll be a cohort, they'll learn different things through interacting with different companies, people and organisations. And we also have, you know, when people come to, we also have this fast track scheme for a digital ready workforce, which, you know, has data scientists, analysts, cybersecurity, project support officers, all sorts of people that the NHS needs to work in a digital NHS, but people still think we just need doctors and nurses. Which is so, we have graduates who come straight from the graduate training scheme or the application for the graduate training scheme. And we just, like a training scheme, we rotate them around South London. The trusts love it because they have someone that they're training and they're getting great experience from. And now that's moved to Yorkshire as well. So this could become a pilot, which Health Education England, that's HEE, takes nationally. Okay, so I'm probably beyond time, so it's 10:20. I won't keep it long. I just wanted to say, well, what did we do in the pandemic? Loads of stuff, but I just show a few slides about that. The first thing that you'll probably be aware of is about supporting remote consultations. So we did absolutely loads in primary and secondary care. So Attend Anywhere, love it or loathe it. We helped everybody get that going via providing technological support, guides and support, webinars, surveys and so on. And we're actually involved in some proper academic evaluation of remote consultations in mental health. I don't think we saw as many tracheostomies as we thought we were going to, but part of our patient safety collaborative work was to around safe tracheostomy. And also you'll be aware that the work that UCLH did on ITU early evidence dissemination, and we did that within South London as well. We took the stuff from UCLP. Yeah, pivoting other care. So, you know, diabetic foot clinic, we had a massive problem with the amount of complications from diabetes in South London. And I just got a sort of great service going when that was no longer the best way to deliver care. So we went more digital and provided phone sort of photo tracking ways of doing that. And one of the biggest things we did was with care homes. I mean, I don't know what people think care homes are, but mainly they're a kind of living room with people in them. They haven't got a temperature probe, they don't have a computer, they don't have Wi-Fi. And then people are expecting them to sort of like integrate care with the NHS in a pandemic, and it's just not going to work. So we managed to get, you know, the 18% of them that were on NHS Net up to 80% during the pandemic, which was massive. We do a lot of data analysis for various different things. There's a few things here. Our NHS people, assessing the digital maturity of care homes, and things like we assessed COVID hot hubs when they started up in Southwark, just to see which models were kind of working better than others. And I already mentioned our kind of like system-wide evaluation of remote consultations in mental health, looking at pros and cons of that. One of the things that I did was convene ethics support in South East London, which has now been taken a bit further. So every week now I chair the South East London Mental Health and Community Ethics Forum. After setting up a task and finish group to kind of, it was quite dicey, as you'll probably be aware, and we're probably delivering care at the end of March, beginning of April, but to make sure the ethics were equivalent across the region, I set up a task and finish group to sort that out, and also to give dial-a-friend support to GPs and community, because lots of hospitals have ethics committees, but GPs don't. And then to give this, this forum support, so you can bring a case or a policy to our ethics forum twice a week. Yeah, we also provided support to mental health trusts via this network when they were perhaps a little bit less, they were less able to access support than before. Just the last couple of slides now. You've all heard of Coordinate My Care. We've been increased the uptake of Coordinate My Care during the pandemic, and now we'll be doing that across London. And what else to pull out from here? Yeah, about remote monitoring care homes. Again, people's fallacy that they think that they might be going somewhere where people know what a blood pressure cuff is. Most care homes are not nursing homes. They do not do things like that. And then the National Innovation Accelerator, which is an ongoing programme, which is chaired by Steve Powis, actually. So I was amazed when I see
just Natasha Curran on that POM talk.
Yeah, so if you can just switch your mic, that'd be great. So yeah, I think I'll stop there, because lots of our companies and the NIA also pivoted to be able to provide things remotely. And yeah, I'd be happy to take your questions, really. So I don't know what, if anything, of that was interesting to you, but be very happy to take any questions.